Welcome back to Good Company. I'm Jordan Borders and I'm on location at Illinois Eye Center. If having a laser pointed at your eye is something that you are a little scared of, I'm joined today by Dr. Kolettis. Thanks, welcome back to the show.
Glad to be back.
And we're talking about a safe FDA-approved procedure, LASIK, today. I'm sure that a lot of you out there have questions. You might have some misconceptions. So Dr. Kolettis is going to clear those up for us today. So Dr. Kolettis, is it true that everybody is a candidate for LASIK?
That would be great for business, but we do actually have some parameters that we like to meet. There are criteria that we use when people come in for an appointment. You have to be the right age. There's a minimum age. 18 is the youngest, approved by the FDA. You have to be healthy. Your eyes have to be healthy. You have to have a treatable prescription. And you have to be motivated and realistic. And if all those are met, then you're an excellent candidate.
Excellent candidate. All right. So then what exactly is LASIK? How does it work?
In the simplest of terms, essentially what we're doing is we're using a laser to reshape the outer sort of layer of the eye called the cornea. And the cornea is responsible for bending light so that it focuses on the nerve tissue in the back called the retina. And if you can alter that shape like glasses and contacts do, but have it be accomplished without contacts and glasses, then you've created the independence that people are seeking.
Okay. So people have the LASIK procedure. What's the recovery time like?
That's one of the nice things about it, and why people, I think, tell other people as to how successful and happy they were. Usually you get the procedure done on a Friday here, and then you go home and you rest, and when you wake up after your first nap, you're able to actually see the television across the room and the clock and so forth and so on. So that initial recovery is very quick. Most people are back to their normal routines within a couple of days, so basically off on Friday, back to work, and life on Monday.
Wow. Okay, so you have that done. You're back on Monday. Then how long does LASIK last for?
It's a good question. There are some misconceptions about it. Whatever changes we make to the eye are permanent.
Okay.
So the tissue doesn't grow back, and therefore whatever we change the shape of remains. The challenging part, of course, is that Mother Nature doesn't stop doing what she does when we complete our part. So it is always possible that a slight change could occur in the future that may require us to go back and talk about whether we need to do a touch-up or something else, but that's a very small percentage of cases. So even though the procedure is permanent, our eyes and their growth is never fully, never fully stops.
Okay. And with any procedure, I imagine that there are some risks that are involved. So what are the risks with LASIK?
Sure. It's a classic disclaimer. No surgery is entirely risk-free, but we try to make sure that any risks are kept to as minimum an occurrence as possible. I think the primary concern that one would have with a LASIK procedure would be an infection. We treat preoperatively with antibiotics. We use antibiotics postoperatively, and I don't want to jinx myself, but doing this for 16 years and still have not experienced a LASIK-related infection.
Okay, that's really good to know, because I think that's one of the things that people are really concerned about.
And it's understandable.
Yeah, anything involving a laser. So in your experience then, once patients get LASIK, is that pretty life-changing for them? Are they very happy with their decision?
I think I can speak to this personally. I had LASIK years ago, and it was singularly one of the most incredible things that I've experienced. As a person who is able to do it for others, being able to walk that walk, I think gives me a perspective that is enjoyable as well as informative. I think that what keeps me coming back for more and doing this over and over again is the positive feedback that I get from the people who I am fortunate enough to actually play a role in impacting their lives in a positive way.
That's really great. Well, Illinois Eye Center has a really great offer for your patients in March with LASIK.
That's right. Yeah.
It's $1,000 off, $1,000. So you guys have to check them out. You can check out Illinois Eye Center online at illinoiseyecenter.com, or you can also call them at 309-243-3811. And don't forget, they have those two convenient locations in Washington and Peoria. Dr. Kolettis, thank you so much for joining us again.
Always a pleasure. Thank you.
All right, keep it right here. We've got more Good Company coming up next.